London City campaigner for the Plant-Based Treaty, and I'm really proud to welcome you to our very special panel. So this afternoon we'll hear from two inspiring panels. The first one is a discussion on how plant-based diets can help tackle the climate crisis, followed by a short break with some green smoothies. Then we'll return for our second panel focusing on policy change and how we can scale up these solutions. We'll finish with a light vegan lunch and a space network, so please do stick around at the end for some food and networking. And for those of you that might be new to the campaign, so the Plant-Based Treaty is a global grassroots initiative working to put food systems at the heart of climate action. We collaborate with cities, institutions and communities to promote plant-based policies, such as things like plant-based defaults, meat-free days and public education campaigns. With 41 cities and close to 250,000 individuals endorsing the Plant-Based Treaty, we're building real momentum for change. So we're so excited to be joined by a brilliant panel of speakers who are helping to lead the way in this movement. So let me introduce them now. So we have Heather Mills, entrepreneur and founder of V-Bites. Recently she added alternative stores to her portfolio and leads innovation in plant-based foods. And we're also thrilled to announce Heather as our latest Plant-Based Treaty ambassador. And next up I'd like to introduce Karen Ridges, so trailblazing media expert and founder of Veggie Vision TV. She's spent decades amplifying ethical brands and vegan campaigns, securing national media coverage and shaping public conversation around compassionate living. Next we have Tanya Hafner, registered dietitian and founder of My NutriWeb, with over 30 years of experience promoting sustainable plant-based nutrition for health of people and the planet. And last but not least, we have our very own James O'Toole, who is the Communications Director for the Plant-Based Treaty. He leads public campaigns and media strategy to drive policy change and food system transformation. And moderating today's session is someone who needs no introduction, the Peter Egan. Acclaimed actor and passionate animal advocate, he uses his voice to promote compassion and a sustainable future. So please join me in giving a warm welcome to our panel, and I'll hand over to you.
Okay, thank you very much, and welcome everyone. Hi, how are you? You all well? All nice and warm? Lovely. Okay, I'm going to kick off here with the first question for the brilliant Heather Mills. Heather, your business V-Bites is a pioneer in plant-based foods. What would you say are some of the challenges plant-based businesses face in growing their consumer base, and how can they innovate to compete with traditional meat industries? And also, have you seen an increase in these challenges in recent years?
Thanks, Peter. Thanks for having me here, Plant-Based Treaty Leah. And sorry if my voice is a bit croaky. I've been doing a lot of work at the moment. It's an ever-changing situation that we need to look at constantly. If you look back 30 years, we've actually gone not quite back 30 years, but the reason it's happened is because, to try and summarise it, is lots of movement in the vegan sector 7 years ago. Suddenly saw this trajectory. Everyone thought, oh, all of us campaigners, you know, we're making a difference, but it was such a tiny difference because the world's all about money. And I've explained this before, but it's important to cover it, that the movement happened when corn sold from 330 million to Exponent, 7 million injection from Exponent, and it was sold on to Mondinis in the Philippines. Mondinis and Henry C. Santos vegan. As soon as that happened, that was a huge increase in a sale price within 2 years, an extra 250 million. The city went, oh, maybe there's something in this vegan. And then the next thing happened was Day of Cheese that we helped in America back in 2009. They sold to the Japanese for 360 million. And so people sat up even more in the city. We wanted to think, oh, it's because people really want to go vegan and this has happened. But it was about the money, sadly, how the world goes round. So we wanted to capitalise on that to save more animals on the planet. And we thought, okay, it's finally shifted. We'd had vegan cafes in Brighton and Chester and free cafes we set up in New York. But we knew that vegan cafes wouldn't last very long if we influenced all the restaurant chains to have vegan options. We knew the best of the best would survive, but we knew it wasn't something you could franchise out like a McDonald's. So we sold Vegites cafes and focused heavily on manufacturing while we saw that there was this increase. The weakness that came in were two things. One, the vegan startups thought they had IP, so they started setting up little factories and getting huge investment from all of these city bankers that wanted a 12 billion IPO like the Beyond Meat, which wasn't realistic. So they were quadrupling unnecessary costs. So we set up huge factories and invited all these small vegan businesses to come and operate from them, but they didn't. And there was a window of opportunity that everything could have stayed safe. And now what's happened is this waterfall shed of hundreds of plant-based vegan businesses going under because they got given, some of them, tens of millions of pounds, didn't know how to spend it, didn't know how to procure properly, didn't know how to do many things that passionate startup vegans do, because I did exactly the same many, many decades ago. So what's happened now is we've had this huge Gardner effect, and we basically need to hold the foundation. The vegans actually have to hold responsibility. I was talking to Karen about where you shop. Now, we wanted to shop in supermarkets, so we encouraged supermarkets to put vegan options in. When they saw this Gardner effect, they basically kicked out Wicked Kitchen, 26.5 million turnover, now down to 1.5 because Tesco's have kicked them out. Everything's gone private label. So whereas before we wanted to go to the supermarkets and buy all the vegan stuff, thinking that they would continue to grow the category and thinking they would continue to support these brands and amazing vegans that were putting things in, it's not the case now, which is why I bought Alternative Store. Apart from helping Zara and Dan out who asked me, I thought we need to have our own supermarket where we control what's going on and where we spend our money, because the supermarkets are just going to carry on private labelling and delisting and offering worse and worse and worse products. So that's why we did the Alternative Stores. All our profits go to animal sanctuaries. I've never took a penny from my business in 30 years. It goes to make a difference. So even though it might be 3 pence more for something, you're actually supporting the vegan movement. We don't charge any vegan businesses to go on the platform and sell, unlike Ocado and Amazon that's destroying the planet. So stop, as a vegan, what can you do? You can actually stop supermarkets and you can buy from vegan family businesses, local farms, and I know it's difficult and I know it's not necessarily convenient, but the Alternative Stores is direct to consumer, up to 30 kilograms direct to vegan restaurants, and then you're controlling the market. It's basically in the right environment. So we can't trust the supermarkets anymore, and the reason Jeff Bezos with his little mini prick dick logo is creating rockets. It's because they know the planet's destroyed and they're looking for where can we go next, and then we'll be all left in this huge disaster. So I couldn't make it any shorter, but it's down to the vegans, because we've got 16 million vegans and veggies in this country who could control the market, and you're not utilising it. You're feeding the pockets of the 5 top money earners in the world.
That's brilliant. Can I ask a quick question, Heather? So Heather, you are supremely successful. So what advice would you give to the smaller vegan producers to follow in your footsteps?
Well, I'm not successful. I've had loads of mistakes. I've done all that. The only good advice I can give is don't make the mistakes I made and keep going. No matter what, keep going. And never, I've spoken to lots of vegan entrepreneurs that have recently gone bankrupt, and I've said, you at least tried. But what you need to do going forward is go and work in the business and the environment that you want to grow. Don't think your passion is going to make your business work, because it won't. You need to understand every layer of it, and you need to group together and not duplicate what other people are doing. Get together with them. If you see somebody doing something similar to you, create a consortium, and then you're powerful. The vegan and dairy industry are powerful because they work as a community. The vegan industry work like Gollum from The Ring, going, it's mine. And I've got a special recipe. You haven't, we do 420 products. It is so rare. I've only seen in 30 years one recipe that we haven't already done a million times over. So it's about your brand, it's about coming together, and working together and communicating and networking and literally stop living in a goldfish bowl and get together like the plant-based treat you're doing, but the end solution is we need to eat. So let's get that group of people together.
That's great advice, and it's also very interesting, if I may say, that, quite right, the thing that kicks us off is passion.
Yeah.
And once that's kicked you off, then you have to start using your head, don't you? Yeah. And start applying real thought process to developing. It's fantastic, thank you so much. Okay, my second question is to the lovely Karen Ridges, who I blame an awful lot for me getting involved in this movement. Karen.
My best day's work.
As the founder of VeggieVision TV, how do you think media and storytelling can shape consumer attitudes toward plant-based eating, particularly among younger or skeptical audiences?
Skeptical audiences. Thank you, Peter. Thank you, Plant-Based Treaty. Can everyone hear me? It's a bit of a weird
further away.
A bit further away. Is that better?
Yeah, perfect.
Oh, thank you. VeggieVision TV. I had this brilliant idea decades ago, and I've run it for love because I'm a passionate vegan and want to make a difference for veganism. And it's always been, for me, Peter, like you just said, storytelling. It's always been about the positive side of veganism, of living, of life. Inspirational people, experts in their field, recipes, not really like some other websites that are a bit of clickbait and, it's doom and gloom news. I'm not about that. There's so much positivity for veganism that, to me, there's no room for the doom and gloom. So I think storytelling is so important. When you meet a vegan, a fellow vegan, apart from it's the most exciting thing ever, you often say, oh, how did you go vegan? What's your story? And it compels us and we find it interesting. And I think even when it's stories not even about veganism, we all love stories. You went to bed as a kid and your parents may have told you a story and you want another one. And, there's probably no surprise that Tom Hardy reading Jack and Ori has had millions of viewers, and I don't think that's because they're all kids wanting a story. So we all love stories. Let's utilise these to promote veganism, and along with the facts. I don't think facts alone are going to really resonate. I think we want to hear the story. And that's what VeggieVision has been all about for me. My main work is my vegan PR work, and I'm so lucky to work with this amazing lady. I cannot tell you what a passionate vegan pioneer Heather Mills is, and I get to chat with her every day, which is incredible. And in the background, VeggieVision, I've got a few people that help me, and now we want to focus on the stories of the vegan businesses, because if we do not champion the vegan businesses, like Heather has said, you don't use them, then you will lose them. And that's what we need to do. And to connect to the younger generation, it's all about being authentic. It's all about meeting them where they are. Going out, maybe giving away free food and talking to them. My son Callum, some people might have seen him, he pops along to events with me. He's nearly 6'5", gym bunny, entrepreneur, lifelong vegan. And he said, Mum, the organisations and the companies, they're not talking to Generation Z. We talk a different language, we use different platforms. And it resonated with him so much. That's what he set his business up to do.
Fantastic.
To connect with the younger generation, because they are on a different planet to us and they are feeling left out, and we need to include them, especially as something as vital as being vegan, because it is the most important subject on the planet.
Yeah,
That's
yeah.
what I feel. Does anyone else feel that? It's
I think we all agree with that. And are there online the links that you're talking about to engage people? Are they clearly there for everyone just to click on and get involved? Does everyone here know how to kind of engage with what both Heather and Karen are talking about?
Well, you must come over to alternative stores.
Yeah.
And my website, as I say, it's just run for fun. However, there's been a mind shift. Past couple of years I've been developing how to help more vegan businesses because they may not always be able to afford PR and they haven't got the time to do it themselves. And that's Veggie Vision TV.
Brilliant.
So alternative stores.
Maybe we should share precisely those addresses today.
Yeah,
so that
please
everyone knows
do.
precisely where to go.
There's so many vegans. If we all support each other, there will be less problems.
Marvellous. Thanks very much, Karen. That was wonderful. Next, thank you everyone. Thank you. Next question is for Tanya Hafner. As a dietitian and founder of My NutriWeb, what are the most common nutritional concerns people raise about plant-based diets, and how can education address these to encourage wider adoption?
Thanks, Peter. I think before I answer your question directly, if I may, I think as a dietitian and as a scientist working in this area for about 30 years, I think I'd like to put this answer in context in saying that there is overwhelming scientific evidence that following a plant-based diet is both good for health, planet, and also the economy now. We've got those stats. And it's unequivocal, and the consensus is there nationally, it's there internationally, and we can all be doing that every single day with every mouthful that we eat and with every meal that we choose to eat. And that's very powerful, something that we can take to eat every single day for our health and for the planet. And I'm sure many of us in the room may be familiar with the Eat Lancet Planetary Health Programme. So that came out in 2019, and there were 37 scientists from various disciplines around the world that came together to decide what is the way that we need to eat that is nutritionally sound, that is also good for the planet, and they came up with this planetary diet. And it is having whole grains, it is having beans, peas, lentils, nuts, fruit and vegetable first. They are the stars, and we have to learn to enjoy those. And you can have a small amount of animal foods if you choose to. But despite all of this evidence, huge evidence, like we should just be doing this like second nature, we've still got questions around the nutritional adequacy of plant-based diets. And in combination with Plant-Based Healthcare Professionals UK, who I support and champion in line with My NutriWeb, which is a nutrition education hub, we've done some insights. And sadly, amongst healthcare professionals, and in particular my own profession, dietitians in particular, are really the ones that are asking all of these questions. And we did a cross-sectional survey. This is our most recent publication in the Journal of Human Nutrition and Dietetics. It was published in February this year. It's representative of Irish dietitians and UK dietitians. And despite the fact that there was general consensus that we should be following a plant-based diet, about 48% had concerns around the nutritional adequacy. So we've got a long way to go. And these are people that, when you look at the insights from the public trust the dietitians the most, they trust the healthcare professionals the most, but they themselves are confused. So we've got a huge job to play with health professionals in building their knowledge, confidence, and understanding and promotion of plant-based diets. So we're working like the clappers really to do this education with healthcare professionals so we can really help with this movement. But to kind of answer your question specifically, I think there's a couple of things we need to think when we talk about all of the nutrients, and we could run a conference on this, which we are doing at the end of the year. But I think there's three things I always say to keep in mind. It's all the answers, whichever nutrient you're talking about, it's about really looking at the quality of the diet, making sure somebody's having diversity, but it's also looking at really thinking about whatever dietary plan that you're following, there are risks and there are benefits. So if you're having a high meat intake, you're going to have too much saturated fat, you're going to risk having not enough fibre. If you're following a vegan diet, you might risk having not enough B12, so you've got to take a B12 supplement. But whatever dietary pattern you're following, there are risks and benefits. So two things, if I have time.
Yeah, go ahead.
What do people say? What are the top questions? One is probably around protein, the second one is around iron. There are others, calcium, selenium, as I said, we could do a whole conference. But if I just maybe talk to protein, because it is the most common question that comes through my NutriWeb and plant-based health professionals UK, it really isn't an issue when you're following even 100% plant-based diets. We overconsume on protein in the UK, for starters. We're totally obsessed with it. It's 45 grams of protein a day for women, it's 60 grams more or less for men, and we overconsume on that. Men are having 80 grams, women are having above 60 grams. Animal protein contains all of the amino acids, which are the building blocks of protein. There's 20 amino acids in there, and 9 are essential. You will get all of those if you just eat chicken, let's say. So meat and dairy foods have been regarded as complete proteins, and so they've been given this halo effect for years. And then plant proteins, if you just eat broccoli, you will be missing out on some amino acids. But here's the thing, we don't eat just single foods, we eat diets. And it's the dietary pattern and the diversity in relation to what I just said earlier that's like really, really important. So if you're mixing up your diet, you're having a diverse diet, you're having enough calories, you will be getting enough protein, and you do not need to obsess about it. And it's a similar vein when you start talking about all of the other nutrients, which I can go on and talk about if you know.
I'll give the mic in a second.
Thanks. Sorry, I'm just want to ask a couple of questions.
Yeah.
Most people don't know I have a PhD in nutrition and food science, and which I only took because every time I did a speech, doctors and scientists said I didn't know what I was talking about, and then I took it, learned nothing because what they teach you, they didn't have a clue either, and then but then I had letters after my name and a doctorate. So one of the key things that's happening at the moment, because I'm a manufacturer of food, we have 3 levels of food. Stage 1 is to convert the fast food junkie. Most of these people in this room will be vegan. They'll know about their nutrition, and if they don't, they will know by the end of this from what you said. However, the caveat to that is, I got Lyme's disease. They wanted to take my colon out and give me a stoma bag, and so for 3 years I couldn't eat vegetables, and I was a vegan for 30 odd years, so it was really difficult. And I kept saying, no, you're not taking out any of my colon, and I'm not living with a stoma bag. I started designing some nice covers for the bag, just in case, but I was like, no. So I started doing, with the Holly Street Gut Clinic, intense microbiome, this is over the last 15 years, and manometries, endoscopies, colonoscopies, and what I found was that a lot of vegans who suddenly go from not being vegan to veganuary got bloated, uncomfortable, gas. And it wasn't explained why to me or to lots of other people, because now I'm 57, when I got to 45, digestive enzymes less hydrochloric acid. So what I think needs to happen, which has been one of the big Gartner effect contributors to people giving up being vegan, and which is what we've just created with a new range for the NHS, because you can save 500 million a year if you just wipe out the steak and chips and ice cream and jelly that they're serving your heart attack recovered granddad. I mean, this country is beyond nuts. So what would you say to people that had fructan, mannitol, sorbitol intolerances, that they don't understand that when they've gone vegan, why they feel so bloated and gassy, how do you encourage them to stay vegan and just tell them to eliminate, maybe it's the cauliflower, maybe it's asparagus, most of the time the garlic and onion. That's the next level for vegans not to go back. Because when they eat, as you'll know, the meat and fish, they don't feel gassed and bloated, but they're dying, and so is the animal. So there's a whole other issue. But a lot of people stay vegan, and I see them. You know, I can see in this room, I can read acid reflux, I can read gut bloating, and I see a lot of vegans not understanding. You can just take 1 or 2 or 3 vegetables out. And the reason I haven't massively talked about this is because it's hard enough to get people to go vegan, to then start saying, well, actually, some of the vegetables are going to, then the meat and dairy industry will jump on it. So now we have the solution of this range of food called No Bloat, by the way, where all the money goes to charity. It's on-the-go stuff that the NHS will start implementing going forward, because we can shout all day about the problem, but we have to give the solution every single time, and that's what's really, really key. So what would you say to bloated vegans who are about to give up and go back to meat and dairy because they feel slender and think they need to have acidosis from excess protein?
Yeah, I think, Heather, it's an amazing, amazing point, amazing question, really important one. And I think we need to do, a lot more around that. You know, we do build that into the education, probably we don't do it enough. And I think the thing is, it is individual. People will experience that to varying degrees, or maybe even not at all. And you know, our gut is the biggest organ in the body. You know, we lay it out, it's the size of a tennis court, and it's got zillions of, you know, microbes, as you know. So everyone's very, very individual, and you will react differently. But yeah, there are top tips, and that needs to be communicated through good storytelling in lots of different ways. And taking it easy, like any dietary change, I think taking it easy, your gut's got to get used to it. And you may need to see a specialist, it depends on your particular personalised health. Maybe see a gut specialist dietitian who really kind of knows about that if you're really having trouble. But I think, you know, going at it one step at a time is a way to introduce that to your gut, generally.
That's really good advice. Can I just make a comment on myself, because I'm probably the oldest person in this room, and I came to plant-based very late in my life, but I had always taken vitamin B all of my life, and Holland and Barrett existed way before plant-based came into being, and doctors were constantly saying you must take your vitamins to carnivores. So there is a balance to be found along here, but from my point of view, my choice to become a vegan was very much an ethical one and not a dietary one. And I would just say to people, focus on the ethical element and then learn about the dietary, because it's your passion and your kindness and your compassion that will keep you on track, rather than your gut that says, I need a bit of chicken, or I need a bit of meat because I don't feel right. That isn't going to answer it. I think the soul and the ethics are the most powerful drivers in our lives. That's all I wanted to say. Our next question is, are you any relation to Peter O'Toole?
Unfortunately not.
This is James O'Toole. What role can public education campaigns play in shifting consumer habits toward plant-based diets?
Thank you. First of all, thanks to my fellow panellists and to Peter and to everyone for coming today. We really appreciate it. And also to Leah and the rest of the Plant-Based Treaty team for putting this event together at such short notice. They can play a critical role. We've seen that before with the tobacco industry. Sustained public education campaigns really drove down smoking rates, and that they've continued to stay low. So we know that they can make a massive difference, and they can be applied to plant-based diets. I think part of the issue at the moment is there is a disconnect with the public health of the products of our animal agriculture, meat, dairy and eggs, and the impact these products have on the environment and health, and also obviously the ethics, like you so eloquently said just then. So, positive public education campaigns raising awareness about the health benefits, the environmental benefits, and the ethical benefits of plant-based diets can play a massive role in driving change, especially if those are focused on making plant-based diets accessible, appealable, and just really exciting for people so they can make those choices.
And what successful examples have you seen, for instance, globally?
There have been many, and it's interesting to talk about stories. New York is probably the leader in the world of plant-based initiatives, and there's a story behind that. The mayor, Eric Adams, he was a New York City cop, and in his mid-50s, he woke up one morning and he was blind. He was unhealthy, he was overweight, and he went to the doctor, and it turns out he had diabetes. He didn't want to take medicine for the rest of his life, so he looked into alternatives to combating diabetes and went on a plant-based diet. And he credits that with reversing his diabetes. And he said to himself, made a promise that if he ever got elected to a position of power, he would pay that forward and educate his constituents on the benefits of plant-based. So that's exactly what he's done. A whole host of initiatives in New York City. In the school system, they have plant-powered Fridays and meat-free Mondays, where all the food is plant-based, apart from, unfortunately in the States, it's federally mandated that dairy milk is served with school meals. So apart from the dairy milk, everything is plant-based. And they also have education campaigns on the subway system, I think it's called Eat More Plants, where people can scan a QR code and it takes them to the official NYC City website, where there are videos on benefits of plant-based diets for health, the environmental impacts of animal agriculture, and also recipes to make it really easy for people to make that shift. A plant-based treaty, so in April this year we launched our 30-day smoothie challenge, which is encouraging people to have a nutritious green smoothie every day for a month. We launched in April, but it's still ongoing. People can go to the website and sign up for that. And again, with a story that is based or thanks to Dr. Brooke Goldner and Thomas Tadlock, who devised this nutritional green smoothie. Dr. Goldner actually reversed her lupus, or she credits a plant-based diet with reversing her lupus. So that's, and we've had really great support from the community and public who have signed up for the challenge. And by the end of the 30 days, people are definitely seeing the benefits of a plant-based diet. In Amsterdam, the city recommends through public education campaign to the community that they have at least 60% plant-based diets, and they also serve exclusively plant-based food at council events. And it's interesting that it's 60% plant-based in Amsterdam, because I think, again, there's a misconception that people think the plant-based treaty is like all or nothing campaign. So yeah, it has to be either completely plant-based or it doesn't count. Definitely not the case. We understand transitioning the global food system is very challenging, and we support any kind of incremental shift in the right direction.
Great, brilliant. It's very sad about Eric Adams, wasn't it, in order to keep his position as mayor of New York. He's a Democrat, but he adopted Donald Trump's position on immigration and deportation. It's terrible. Yeah. I'm so pleased to see he was a vegan as well. It's wonderful. Okay, this is a question for everyone, and I'll just go through rather than everyone talking at once. What can towns and cities do to promote healthy eating, particularly plant-based diets, in their communities? Heather?
It's funny you talked about New York, because we set up the New York Coalition for Healthy School Foods about 7 years before he came in, and we donated $1 million worth of food to the Hunts Point Alliance for Children. And what we managed to do was we set up free V-Bites cafes next to all the McDonald's, and in the Hunts Point area, a lot of drug addicted parents, kids only get $1 a day to eat, so it was, they're going to go to McDonald's. It was a 99-cent burger. So we set up free cafes so that they could keep the pound and literally they could come in for free V-Bites burgers. This went on for about 4 years, and then on the top of the rooftops we taught them how to grow vegetables, and we did blood tests that basically got the kids engaged, rather than come back and get on a phone or a computer, they ran in and wanted to see if their carrot had grown or their courgette had grown. And then we got them to learn how to cook. And then we followed the blood series, which is what influenced the whole situation, so that they could reverse type 2 diabetes in 3 months, type 1 insulin injections down from 6 to 2, and the brain function in the school results went up by 44% throughout all the schools throughout New York State. So it's giving the solution rather than the complaint to every single possible situation is the only way that we're going to change things. So if you are a mum or dad at school, go in, speak to the head and say, can I do a cooking thing with all the kids? You know, there's lots of solutions for things like that, but I'll pass it over to you.
Thank you. I'm just going to go back because I made a promise to myself, whenever anybody says about diabetes, we all understand that there's a big difference between type 1 and type 2. Type 2, your diabetes can go into remission on a vegan way of eating, a vegan diet. Type 1, which mainly affects children, as it does my son, we live with it 24/7. The best thing my son can be is a vegan with type 1 diabetes, but it will not reverse type 1. Just wanted to make that distinction because I promised myself, because type 1 affects children and they're fed up with people going up to them thinking a 5-year-old kid has eaten wrong. It hasn't, it's an autoimmune condition. Type 2 is very different.
However, having studied that for 20 years as well, you can reduce the insulin injections on that diet, and it's really, really key. And the reason I got involved with it is because most amputees lose their legs from diabetes later in life, and that's why plant-based is even more important, because less use of the insulin, which creates the problems with the loss of the limb.
100%. When you see what kids eat, it will, we won't go down there. Doing something in your community. I've been passionate about doing things in Essex for the past 30 years. I've lost count the amount of times I've taken V-Bites products into BBC Essex, and everybody has bloody loved them. Jevons chocolate, I took it into the biggest radio station in Essex. My brain is very media, because I know through the media we can reach a lot more people. So if this was some advice or tips for anybody here, I would be saying really make use of your local media, whether that's going into your radio station with lovely vegan food or connecting to local celebrities, your local media. I've coached media to be vegan and it's wonderful. So maybe they're just some quick ideas.
Time for more? I think hospitals are really interesting to me. We're trying to advocate within hospitals at the moment. It's not easy, but I do think healthcare needs to imitate what health is rather than being a sick care system. 60 to 70% of patients within the hospital are not nutritionally vulnerable, and we should be serving them delicious, healthy, plant-based foods. That's where it needs to start, and it's not happening. It's not happening because of contracts with enormous companies that have a power over the NHS, and that's a huge problem. I can't believe it when I got into it that it was just so complex and difficult to change. We've just submitted a grant to NIHR to do plant-based by default across England. That's been rejected, but we're now looking for more funding to kind of inactivate that with UCL Behaviour Change Unit. I'm really confident that we can achieve that within the UK despite all of the economic and system challenges. But I think sorry if I could just say, as a public, if you're in hospitals, make a complaint, send it to the top. We need the voice of people to be saying that. You know, to see processed meats on the plates, to see vending machines full of HFSS foods while you're waiting in the corridor and I've got nothing else to eat is just atrocious.
Absolutely. Thank you. James, can I have my mic back?
Yeah.
Thank you.
So just touching on that's a great point, because in the UK, the NHS, it does make it challenging for that. the plant-based treaty is a global treaty, and we work with cities to see what's going to work for them. In New York City, actually, in the 11 public hospitals that the mayor has remit over, they do have plant-based by default, and that's seen a 60% uptake, and led to 59 cents cost saving per meal, and the meals are about $3 or $4. So it shows that it can be done, but it varies from city to city. Just an example closer to home, in Salford, in Greater Manchester, we work with the council to put plant-based starter kits in community hubs across the city, community centres, schools, libraries, that sort of thing, and they think they'll be seen by 1 million people per year. So it does vary. So the role cities can take is something that we work closely with them to see what's going to be a good fit for them.
Brilliant, fantastic. If I can just say on a personal note, when I turned 55, which was just a year or two ago, I was diagnosed with type 2 diabetes, and I was prescribed metformin, I think it was called.
Yeah.
And when I went plant-based, suddenly, nothing to do with taking the drug, but my doctor said, "Oh God, it's changed, your diabetes is gone. What have you done?" And that was a year after being plant-based. Apropos hospitals, I've been supporting a group of doctors and nutritionists who have worked out and presented it to the NHS that if they were to convert to a plant-based diet, it would save the NHS £250 million a year in terms of foods. Okay, I'm just going to open now to questions from the floor. I'm sorry, I'm just reading your list. I think we'll just go to the floor in terms of time. Yeah. So anyone, raise your hands if you have a question, and we'll give you a mic.
Hi, do you want to introduce yourself?
Yeah.
Florence Jones, I'm a journalist with Sustainable Views at FT. I have a question, I think probably for James, but anyone else as well, on policy and what policymakers can do to support the treaty, but also like wider dietary change, particularly in the UK, looking at the food strategy coming up at the moment.
Did everyone hear that question?
Yeah.
Yes? Okay.
Thank you. It's a great question. The first thing they can do is support the treaty. That'd be nice. And on our website, actually, we have an email action campaign where members of the public can put in their postcode. It's a global thing, so council members in other countries, and it will automatically populate an email that is sent to the local council member asking them to support the treaty, but also put forward a motion. So they can put forward a motion to implement a plant-based action plan with lots of different initiatives that again do vary from city to city. That's a couple of things that councils can do.
Can I just say? Sorry. One of the most important things that people can do, and I'm speaking at the moment, if you're lucky enough to have any form of insurance companies around the world want to keep you healthy, pharmaceutical companies want to keep you sick. So the most important thing we're doing at the moment with the Montefiore hospitals around New York is getting the insurance companies on board, so your insurance quotes can be reduced when you're plant-based and when you're healthy, and you shouldn't be analysed the same as somebody that's got a horrific diet. I think in the UK the policy needs to change where huge taxes need to go on abusive foods to kids. Obviously most of them are abusive to animals, but sugars and things like that should be hugely taxed, and all fruits and vegetables and grains and everything should have zero tax on them whatsoever, because all of the subsidies are going into farming. Subsidies should then be allocated equally to people growing oats and to growing different plants to help them convert their land into, which a lot's been created in desertification, especially in America. So I think there's loads of solutions like that can happen.
I think that's a brilliant initiative.
Yeah, thanks. So just another one from New York, actually. but on the subsidies point. So they offer rebates in the City of New York for stores that offer at least 25% shelf space to healthy food like fruit and vegetables. They get like a tax rebate. So there are lots of different ways that cities can make a difference.
Great. Are you going to answer?
Yeah, just to say, I think there's...
Sorry, I didn't mean to sound so rude.
Can I? I think there's a whole... There's not one solution, it's multiple solutions. So if there's something floats your boat around a policy change, I would say just get involved in it. I feel particularly passionate about subsidies for farmers. If the meat and dairy industry didn't have the subsidies that were given by government that I paid for through my taxes, nobody could actually afford to eat meat. So I think that's really important.
That's what we want.
And so we're getting subsidies for plant-based, for horticulture, rewilding, etc. And I think the other thing is marketing. Marketing works. We worked with food companies. We're trying to move the dial with food companies. Marketing is really clever, and if we can bring in policies where we can only take HFSS off the billboards and only market healthy foods, we will be in a much healthier environment. But there's multiple things that we should be doing at policy level.
Absolutely.
And it's just so sad that some of the people that are sitting on the food strategy board at the moment are from companies like Cranswick, which are just really driving ill health and poor animal welfare. I could go on.
That's wonderful. Okay, the gentleman over there, have your hand. I'll come to you in a second.
Thank you. I'm actually going to be on one of the panels later. I wondered if you could tell me, I find as I go to the supermarket, I spend more and more time looking at the ingredients, and it seems that as every year goes past, the type gets smaller. At least that's how it seems. I wondered how you're getting on with sort of use of vegan trademarks, what experience you've had, and maybe you could just let me know how your experience with trademarks and labelling of food.
Is there not an app that you can use to go onto the barcode, and the barcode will tell you everything, all the ingredients in the product that you're looking at? Have you come across that?
There is an yeah, it's not always correct, but it's better than it's better than
Better
nothing.
than straining your eyes.
Yeah.
Okay, okay, I'll answer the question. 30 years ago the Vegan Society label was extremely trusted as it is now, and that was something that I would always look out for. I'm always reading labels, and they are always getting bloody smaller with the writing. I had a client say to me yesterday, they're so proud of their vegan business, but they cannot afford the accreditation. Some of these accreditations cost a hell of a lot of money. Probably a lot of work behind the scenes goes into that label.
So you have to pay for that. I don't know if this has just died. I trust the Viva accreditation very greatly. I've been with Viva for 30 years. Heather is their patron.
And there you go. So, and I think some labels are more trustworthy maybe than others.
Expand on your question a bit more, because it was just
I've heard
trademark.
different, without a microphone, I've heard different stories about different trademarks.
Yeah.
I was involved, I'm former chair of the trustees of the Vegan Society.
So thank you. I've got an interest. Well, I've heard different stories. There is a slew of different trademarks and intellectual property, and I've heard different stories. Even this morning, I was talking to someone who was having trouble getting accredited, and I just wanted to perhaps Heather especially. You've probably forgotten more.
We've had the Vegan Society, we've got the Kosher Society. We're one of the few that make super kosher food, halal, everything. Obviously all 100% vegan. So it depends what you're trying to achieve. The Vegan Society, it's an important one to have on there generally for people who don't understand vegan and can't read ingredients properly, and also to know that it's been vetted. And this is what is really important, is everything has to be checked from where it's come from and what process to the end. Don't know how much due diligence is really done on that. I know it is on my company, but it's really important to understand that you know where your products are coming from and what they're made of. Like, we get soy from Austria, we don't get it from China, you know, and we pay a lot more for it, but it's high quality, and it's because we can't grow soy in the UK yet. We're looking at that with hydroponics. But I think it's really important, depending on what the product is, what the demands are, and also the costing. I think it's really important that these trademarks and stamps look at startups with a much lower price than a bigger company. I think that's really important, that those conversations need to go on, and I don't think they are enough.
Brilliant. We've only got a few minutes left, so one more question. I'll come to you in 1 second. Before we go to that question, Leo, if you wouldn't mind, I have a very good friend here today, who is the man, through his court case a few years ago, actually got veganism ratified as an accepted lifestyle. His name is Jordi. Where are you? Stand up to the great man.
I expect me to say something.
Yeah, how did you do that?
Yes, but any of you in my position,
Take
Take it away, Jordi.
any of you in my position will have to understand things. So we're all vegans, we all been persecuted for our beliefs, and I just was in the right place in the right time. And being a vegan, I never forgot the opportunity to push the vegan message beyond, and anything bad that happens to you, you can make it good for the vegan cause.
Well, that's wonderful. It goes without saying that you were incredibly courageous and committed in your battle, Jordi. You were fantastic. Okay, young lady over there.
Oh, I like the young. Thank you.
All right.
Just a little bit at the right time. Hi, yeah, so my name's Joan. I've been an ethical vegan for 45 years, so I've spent the best part of my life now.
You don't look it.
In my age range. So I now practice as a clinical nutritional therapist, naturopath, and also functional diagnostic practitioner. So I work from a preventative measure. So all clients that come to me, I use diagnostic testing to ascertain illness and conditions, whether it's genetic or just general age-onset illness. So when I'm liaising with medical doctors, which I generally do, because obviously I sometimes have to refer back to get testing done, why is it that we are met with such adversity? They don't want to speak to us, they don't want us under the NHS. And what I'd like to see in the NHS is a preventative care. So somebody like myself or other naturopaths or clinical nutritionists would work under the NHS from a preventative measure, and we can work alongside medical doctors, reducing the deficit on the NHS and get patients well from a preventative measure, so that our beloved NHS is lasting for years to come. That's what I'd like to see.
I'll just comment on that quickly and then I'll pass it over. And that's why we got in touch with insurance companies, because it's all about data.
Yeah.
If you can prove enough evidence that it is what's written on the packet, like we did in New York, then they have to move it on in effect. So if anyone's lucky enough to have private healthcare insurance, Bupa and AXA and a number of them are going to be, over the next, probably happen in 18 months, start doing those initiatives and looking at that data and collecting it so that they can say, look, it's a three-pronged attack. If someone's in hospital and you're feeding them shit, you have to clean up that shit. They've got diarrhea and constipation. The nurse has 10 times more work to do. They're in bed longer, so the beds are full all the time. The person's not back to work, or they're obese, or they're living off disability benefit. And it's like what we did with prosthetics in the 90s. When they gave me my first leg, it was the ugliest looking thing ever. And I went, what's that? I said, man and two swords down the road here has better looking legs than that. And they wouldn't work with all the limbs I developed with my team, the running legs, the skiing legs, all the things that have happened over the last 30 years. It was about problem solving that. So it's basically, as soon as I showed them, and it comes down to money, as soon as I showed them, it's £200 more for the limb that we've developed, but that person can walk comfortably, they can go to work, they can pay taxes, they're not claiming disability benefit. And if we can make the government currently look at everything in a macro instead of one linear way of things happening, then you show, like you were talking about, $250 million. We've done it on one trust test where it's 500 million just for one region in the UK in savings. You don't ask a sick person in a hospital bed, what do you want to eat? You say, 3 choices made, eat it or eat nothing. If you eat nothing and drink water for 3 days, unless an exceptional illness, it's only going to help you anyway. You're only going to be out of bed quicker. So we need to have dictators in hospitals saying, the second you walk in here, everything you said about preventativeness, it's a wellness place. It is not a place for you to have steak and mash and ice cream and jelly. You are doing this. You are not allowed to go out and suck on your cigarette with your oxygen pump while we, the taxpayers, pay for your care. That is illegal, and that's what they do in Singapore. And I think we need to bring a lot more of Singapore here.
Last comment from the panel, Tanya, please.
Thank you. Thanks, Heather. I agree with everything you said. Data's everything. You asked the original question, why don't doctors care? Doctors do care, but they're not trained. They get 1 hour of nutrition training. Wow. It's a sick care system. They're focused on treatment. They're in a system that just doesn't work for them, doesn't work for the patients. So my son's just becoming a doctor, and he's really learning about that, and it's really, really tough. And I've come back to the fact that it is about data. We've implemented nutrition on the curriculum for medics. We've achieved that now. We've now got sustainable plant-based diets on the curriculum for dietitians, but that's just not going to change everything. And it's got to come back to policy change. It's got to come back to investment from the NHS to wake up, to bring prevention into healthcare. And if you just think about these stats, research from the Office of National Statistics found last year that if everybody in England ate a plant-based diet, NHS expenditure could be reduced by an estimated 6.7 billion, with 2.1 million fewer cases of disease and a gain of 170k adjusted quality life years. I mean, why aren't we doing it? So it's about pressing on policy and overcoming commercial interests, in my view.
Brilliant. Wonderful. Okay, Leo now is going to wrap up this session. We've had another session in our quarter now.
Yes. So thank you very much, everyone, for your questions. So we're going to take a quick 10-minute break. Help yourself to a smoothie at the back, and we will return in about 10-15 minutes for the panel on policy change. Can we stand around the applause for our fabulous